Namaste to all. I am Dr. Jayashree, Consultant Microbiologist at Apollo Hospitals Bangalore. I will be talking on infection prevention and control for public awareness. So these are set of measures to prevent and to contain the spread of infectious disease. So these set of measures include, the first and foremost is hand hygiene, which is a very simple, easy way and very cheap method of preventing spread of infection either in the society or in the hospital. So what do you mean by hand hygiene? It is simple way of washing the hand with soap and water or using hand sanitizer. So ample amount of soap should be used and minimum contact time is 20 seconds for doing the hand wash. So which will get rid of all germs which are there in the hand, which causes the spread of infection. So how many times should we use the washing with soap and water? As much as possible, and it depends upon where you are working, whether you are at home or where you are in the working place. So if you are at home, minimum number of time required is before having your food, after the food, after coming out from the washroom, and especially if you are in the kitchen, those who are food handlers working in the kitchen, you should be washing the hand before starting the cooking and in between also, so that because they can be carriers for infection and the diarrheal disease can be spread through the food. In case if you are traveling, you may not have access to soap and water. In that case, keep a hand sanitizer with you, which should contain minimum 60 to 70% of alcohol, which can be used as and when required, especially when you touch a common areas like a lift button or a door knob. So you keep using the hand sanitizer. The second important set of measure is respiratory hygiene or cough etiquette. So diseases which are transmitted through respiratory route, which include the common flu, influenza virus, and the recent COVID virus. These are examples for respiratory route of diseases, which can be either through a droplet infection or it can be airborne. Simple way to contain the infection is using a simple mask. A simple mask is good enough, which will prevent the spread of infection and it will contain the infection. In case if mask is not available, you can use a tissue paper while coughing or sneezing, and once you finish using it, please ensure that you are discarding in the waste bin. In case if tissue paper is also not available, you can use your elbow for sneezing and coughing, so that the virus or the germs or bacteria is contained, rather than using your hand or just coughing or sneezing to the atmosphere, which can spread the disease, germs, and it will stay there in the environment for a longer time. And keep a social distance, especially if you are sick with a respiratory infection, keep a social distance of at least 1 meter or 3 feet. Avoid gathering. The children who are going to school or going to the college, or if you are working personnel, avoid going to the workplace or to the school or to the college, and stay at home till you recover from the illness. And at home also, especially if you have old people at home, please ensure that you are isolated yourself either in a separate room. If that is not available, wear a mask or at least keep a distance of 1 meter, that is 3 feet, so that you avoid the spread of infection. Another important set of measure is the cleanliness, environmental cleaning or surface cleaning, which is very important to prevent the spread of infection. As already mentioned, when you cough or sneeze into the atmosphere, what happened? Millions of germs are entering in the atmosphere, which can stay for hours together or sometimes days together on the surface, viable, which somebody can come in contact with that either by touching the surface and then later touching the mouth or nose. That infection is spread. To prevent that, environmental cleaning with the appropriate disinfectant is very important. You can use a bleaching powder, which is a very economically, it's available easily, which will clear off all germs found on the surface. But one disadvantage of using a bleaching powder is it is corrosive, especially when you use for a long term on the metals or stainless steel, it corrodes metal. So instead of that, you can use any household disinfectant available like Lysol can be used and frequently clean the surface, especially if you have sick people at home, ensure that the room is cleaned frequently. And the accumulation of dust will always invite germs which will multiply. Another important set of measures for the infection prevention is while handling the food and water. As you know, the food and water, these are the source of vehicle for transmission of diarrhea and dysentery. The drinking water, now most at home, most of them will be available, will be having the water purifier, which will ensure that the water we are drinking is potable. But it's very important to have a maintenance of your water purifier in terms of either changing the filter or cleaning the filter as per the schedule. If you are not sure about the maintenance of the water purifier, please ensure that you are boiling the water before drinking. Similar way, the food. Ensure that the food, vegetables or fruits, what you are buying is cleaned properly before cooking it, or if you are using raw vegetables for salad, please ensure it is washed thoroughly. And the vegetables which are to be used after cooking, ensure that it is cooked properly, especially non-vegetarian items. Improper cooking can be a source of infection. A meat can be a source of infection, especially the diseases like dysentery, typhoid. Another important measure of infection control is the vector-borne diseases. As you know, in India, due to the weather, it is a home for a lot of vector-borne diseases. Very commonly we see, especially after once you start the rainy season, mosquitoes, insects. So please ensure that there is no stagnant water at home or around your home, especially those who are having the indoor plants, because diseases, certain mosquitoes which causes dengue, chikungunya, they will breed they will bite, they are day biting mosquitoes. They will breed when there is a stagnant water, multiply, and which will cause diseases and spread infection. So usually from June we will see the dengue infection season along with the chikungunya. So ensure that there is no stagnant water in and around home, especially those who are having indoor plants. Another important measure is immunoprophylaxis, or called vaccination. The government has given a set of guidelines for childhood immunization or vaccination. Please follow that, so that there are set of diseases which are vaccine preventable, which can be away from the infection, or the severity can be reduced. There are even adult vaccinations are there, and there are certain vaccines, for example flu, annual shot is required. So every year we need to take the vaccine because the strain keep changing. So please ensure that you follow your doctor's guideline and taking vaccine. And the recent addition to the vaccination is our COVID-19 vaccine, which need to be take booster dose. So as and when required, annual booster dose should be taken, and it is extending the age to even to the pediatric age group it is started. Please ensure that all are taking vaccine at the appropriate time in order to reduce the severity of infection. So this is in nutshell, in short, about the set of measures to prevent and contain the infectious disease, which can be done very easily at home and those who are going out from home. So in brief, hand hygiene, your cough etiquette, surface cleaning, care to be taken while handling water, food, vaccination, keep away from your insects, mosquitoes. Before I conclude, I would like to talk about little bit about monkeypox. Nowadays we hear more often with the monkeypox. So what is that monkeypox disease? These are viral zoonotic disease. So what do you mean by viral zoonotic disease? It is caused by a pox virus. Zoonotic disease means the disease which are transmitted from animals to human being and from human to human. So which is the animal in monkeypox? These are rodents, which include rat, mice. So is it a new disease? No, it is not a new disease. This disease was there before also, but endemic in certain countries like African countries. But now it has become more important. Why? Because from the endemic country, it has come to the non-endemic countries, such as it is reported from North America, Europe. Now, as of now, there are more than 250 cases of monkeypox disease spread across around 23 nations. But luckily, there is no death reported. So, what are the symptoms of the disease? The patient will present with fever, headache, myalgia, and third day the rashes starts, which are blisters. So, how it spreads? It spreads from rodent to human being, either by the contact with the secretions or by the bite, and from human to human it is a contact either through the touch contact with the secretions. It can be a respiratory contact or the contact with the blister fluid. Spreads from human being to human being. So, is it a severe disease? No. As of now, there is no mortality, no death reported. So, this is self-limiting diseases. It takes around 2 to 4 weeks to subside. So, this shows that there is more and more communicable disease incidence is increasing. So, the public should be aware about what are the measures, infection control measures to be taken to contain this. Thank you.